there's an important thing when we talk about infant mortality I want everyone to know. From a definition standpoint, we talk about infant mortality in what's known as a rate. And the rate of infant mortality you'll see in the top corner up to the right. It's the number of infant deaths that do not live to their first birthday. And we take that and divide it by 1,000 live births. So it's important to know the numbers we're looking at here are not percentages, that are a rate per 1,000 births. So if we look at the country, the first ooh and ah moment here is that if you look at this scale or the gradient to the bottom, the lighter blue are the states that do the best. The darker blue all the way to the right that say 7 are the states that do the worst. If we look at the totality of the United States, we see that the average infant mortality rate is 6.0, and I want you to know that that is consistent with the Healthy People 2020 goal, and the Healthy People 2020 data is a 10-year national objective that's determined by the U.S. Department of Health and Human Services, and it goes all the way back to 1979. Now, if we look at some of these states, you'll notice the lighter blue colors. These are states like, to the left and up, Washington, California. When we think California, let's think of big cities like LA, Utah and Colorado, Minnesota and Iowa. Then we get all the way to the north and to the east, states like Vermont, New Hampshire, Massachusetts, Connecticut, Rhode Island, Maryland, New York, including New York City, Maryland, including the District of Columbia. And what should be troubling to us as we look at this slide is that the large cities I've mentioned in totality of the state have a much, much better infant mortality rate than we do in Ohio. The lowest infant mortality rate is in Massachusetts at 4.3, and the highest is in the state of Mississippi, 8.9. And Reed has citations there for you. Here's another ooh and ah moment. You can see the state of Ohio in a number of colors. Can anyone guess for us what those colors mean? Any good guesses? I had studied this for 10 minutes trying to figure it out, and I called Reed. Reed, what's the answer?
It looks pretty.
The issue here is that when you look at the state of Ohio, our infant mortality is 7.1, and we've already compared that back to our state rate of our national rate is 6.0. I'm going to step away from a rate for a second just to give you a percentage. If you compare 7.1 to 6.0 as a percentage, the state of Ohio is 18.3% higher in its infant mortality rate than the nation. Again, that puts us 44th among all states. And that's not 44th best, folks. That's 44th in the other direction. That means that states like, and this number adjusts annually, but states like Mississippi, Alabama, Louisiana, Oklahoma, West Virginia, and South Carolina are the states that have worse rates of infant mortality than the Buckeye State. And to make matters a little more concerning, if you take Ohio and you average it over the last 10 years, our infant mortality rate is 7.6. Here's Richland County. We've talked about a national rate of 6. We've talked about a state rate of 7.1. The Richland County rate is 10.4. That is not a good number. There were 12 deaths in 2016 out of 1,154 births. The good news is that our 7-year rate is 7.3, which is somewhat consistent with the state's rate of 7.1, but I can tell you a rate of 12 is troubling. Next slide, please, Reed. Let's look at infant mortality by ethnicity in 2016. We've talked about the rates at the top. Let's look at this by race. National rate. If you're a black baby born in this country, the infant mortality rate for you is 10.8. If you're a white baby born in the United States, your infant mortality is 5.1. And I think we can see simply that's a greater than 2-to-1 ratio of infant deaths that are black. If we go to Ohio, the variation goes from 12.9 if you're black, higher in Ohio than across the country, and if you're white it's 6.3, and that's nearly exactly 2 to 1. You can see the Hispanic rates accordingly. This should give us more than some pause for concern about this issue in our state. Let's go to Richland County. The good news here on a rate-adjusted basis is that the black infant mortality rate for 2016 is 2.6. And I want you to know that's probably not at all due to some aberration or luck or coincidence. There are agencies in the room, our colleagues in CHAP, our colleagues at 3rd Street, many of our folks in public health and home visiting services that work very hard. And the good news is we have a rate in our black community that we feel is more complementary than what we see across the state and across the country. However, if we look at the white infant mortality rate in this county, we see the ratio of 3 to 1. And it's 3 to 1 in a different direction. When you go to the bottom of the slide, you'll see something talked about infant mortality causes of death. And you know, if we take a pause for just a moment, for those of you that are healthcare professionals in the room, and I believe not only from the healthcare side of facilities, but those of you who are nurses and physicians in the room, you have all experienced, and as parents, you've experienced the small miracle of a child being born. And for those of folks who are health professionals, they'll tell you that every one of those is a small miracle. But there are times in nature, and there are times in medicine, and there are times in the advancement of medicine in this country where we do not have as many babies born healthy or alive. So when we look at infant mortality causes at the bottom of the screen, we're concerned about things like prematurity. We're concerned about things like other causes or undetermined causes of death. These are things like health conditions, illnesses, less than healthy pregnancies, and outcomes. The third highest in the order of infant deaths is sleep-related. This is where we're concentrating our focus here today. Next is birth defects and genetic conditions. If we look at Richland County's 12 cases in 2016, 5 of those were by prematurity. 1 was general prematurity, 4 were extreme prematurity. That tells us by suggestion and innuendo these children were born very, very, very early in the gestational period. We've had 1 undetermined cause of death in an infant, and 4 were due to medical related causes, not prematurity, but likely congenital. We have 2 that are pending coroner's reporting. 5142 adds up to 12, particular to Richland County. Next slide, please. Here's something else that we should learn from the opportunity of the day and the afternoon here. Infant mortality by age of mother. Something should jump out at us. If you're 25 to 39, if you look at that data in the center of that slide, there's some very good news nationally as well as Ohio. If you're 15 to 24, there's cause for some concern, especially if you look at Ohio's rate at that age of 15 to 29. It's double digits. We're also finding mothers having babies later in life. And that 7.6 is beyond the 6.0 national average. And if you're in Ohio, that's 10.8.